Bismillahirrahmanirrahim. So today we are going to discuss about the topic of Eales disease. So Eales disease is an idiopathic occlusive peripheral periphlebitis. You can remember it as IOP. IOPP idiopathic occlusive peripheral periphlebitis यानी कि रेटिना के पेरिफ्री में आपको फ्लेबाइटस मिलेगा यानी वास्कुलाइटिस मिलेगा, इन्फ्लेमेशन मिलेगी। अच्छा, जो ईल्स डिजीज़ है बेसिकली ये कॉमन है यंग मेल्स ऑफ साउथ एशियन ओरिजिन। सो इट मोस्टली अफेक्ट्स both eyes but asymmetrically, and it has 3 stages. You can remember it by a mnemonic of ION: inflammatory, then occlusive and neovascular stages. You can see these stages in these pictures, as the picture 1 is showing the occlusive and stage and vascular sheathing. Vascular sheathing is showing inflammatory signs, and there is occlusive stage, and the third one is the neovascular stage. You can see this in picture number B. And picture number C is depicting about the vascular occlusion. Some hemorrhages are shown and localized laser scars are present in the upper segment. So we can remember the mnemonic ION: inflammatory, occlusive and neovascular stage. But how does the patient present? Can present with floaters or sudden decrease in vision. On examination, we can find mild anterior uveitis, neurological systemic features, vitreous hemorrhage. Vitreous hemorrhage is very common. About 1/3 of the eyes present with the vitreous hemorrhage. So fundus findings can be, if there is inflammatory stage, we can see perivascular sheathing, superficial hemorrhages, cotton wool spots, and if the eye has occlusive stage, we can see branch retinal vascular occlusion signs. If it is passing through the neovascularization stage, then we can appreciate NVDs, new vessels, or you can also see vitreous hemorrhage due to rupture of these new vessels. So investigations to rule out the differential diagnosis involves the TB, sarcoidosis, hemoglobinopathies. So in TB we can do quantiferon TB test, and serum ACE levels for sarcoidosis and hemoglobinopathies should also be ruled out. Tuberculin hypersensitivity is the etiology. अहमद अबीबी ट्रीटमेंट जो है वो डिपेंड करता है अपॉन द स्टेज. If there is inflammatory stage, we can give steroids. If there is suspicion of tuberculosis, then we can give anti-tuberculous drugs with the steroids. And if there is in neovascular stage, then photocoagulation, anti-VEGF, intravitreal anti-VEGF, or vitrectomy can be done. There are many complications of Eales disease, like tractional retinal detachment, neovascular glaucoma, cataract, uveitis, and macular epiretinal membrane. So we have to see these as well. Clinically, we can observe snowballs as well in the vitreous. That's all. Thank you.